Hammer, you're recognized for a question.
Thank you, Mr. Chair. And this is for Dr. Romero, if you would, please. And if, over here, sir.
Thank you, sir.
Thank you. If mask, the purpose of wearing the mask is to stop the spread of the disease or to stop a person from becoming infected with the disease, which one or both?
It is primarily for limiting the spread of the disease. The masks, these types of masks, the general masks that we are using in public do not prevent infection of the wearer. The medical masks, that is the N95 mask, is designed to do that.
Okay, and recently, I was trying to pull it up and I can't find it, but recently I think an article came out that as far as contact, surface contact, that they've kind of determined that that's really not an issue. What's your comments on that?
I think that has sort of been walked back. That was I think that was a comment by the World Health Organization, and that has been walked back. The virus is transmissible through contact. That is, you touch an environment and then touch yourself and infect yourself. So it's not the primary mode of transmission, but it can occur. It's one of the reasons why we recommend, and you'll excuse me for touching my mask, these masks slip down. I know you're not supposed to touch your face, but this is why I'm doing this, is because I have to pull it back up over my nose. We know that that's why we recommend sanitation, that is sanitizing the surfaces. That premise, that idea is not new. In many of the respiratory viruses in children, they are spread through contact.
Okay, and so why would it not be, and I think I know the answer, I want to hear your answer, why would it not be good enough that if I'm concerned that I might catch it, that I would be required or requested to wear the mask, but if I'm not worried about it, I would be mandated to wear the mask?
I'm sorry, sir, I'm not quite sure I'm catching your question.
Okay, so why are we, if I'm concerned that I'm going to catch the disease, then out of my own interest for my own health,
yes, sir,
I'm going to wear a mask. Why would it be, okay, I think you know where I'm going.
I know, now I understand your question, sir. So the reason why we ask you to please wear the mask and mandate it is because it is a way of decreasing the spread of the virus, right? It is because 40%, up to 40% of individuals who have COVID do not have symptoms. And you are most infectious in the pre and immediately after the development of symptoms. So it is during that time that you want to prevent infection as much as possible. That's why the recommendation is there. It's because you want to limit the spread to others. My wearing of the mask, okay, is my way of preventing another individual becoming infected.
What is that time frame you just referenced between the time the person becomes, between the time the person actually contracts it and that most probable time frame that they're going to spread it? Is it 1 day, 2 day, 3 day, or?
So let me say that. Let me go back and restate that another way. So you can begin to shed the virus 72 to 48 hours prior to developing symptoms. Okay, and then remember that 40% of all individuals have no symptoms whatsoever. You can shed the virus for as long as 14 days after infection. Okay? If you're a normal individual. If you have a severe infection, if you are immunocompromised, and possibly if you are elderly, you may shed it for 20 to 28 days. So it's not a finite period in which you can shed the virus. Everyone is different. And so the highest rate of shedding occurs prior to, during the first days of infection, and then rapidly falls off as you develop an immune response. And again, forgive me, this mask keeps slipping down my face.
Okay. The last thing I'd ask you is, I'm not a medical profession, I'm a layman, just try to sort things out. How do we deal with conflicting information? Even the World Health Organization has flip-flopped on some of this stuff so much that, you know, we sit here as lawmakers and policymakers and have these debates, and after a while, credibility becomes in question as far as you hold up two reputable physicians, two reputable organizations, two reputable whatever, and, you know, they don't agree with each other. And here we are in the middle, supposed to decide who to believe and line up behind who. Take to the point, Representative Payton, though, you know, we want to protect the nearest and dearest as far as our constitutional rights. So give me a little guidance in response to that. Who are we supposed to believe?
Sure. So I think part of this has to deal with the source itself. Is the source reputable? Is it peer-reviewed? Is the information you're receiving, okay, been reviewed by other experts in the field? And a word of that. In the information age that we exist in, where information is virtually instantaneous, that is, a study or information becomes available and it is rapidly shunted out into the public, okay? Without peer review, we can have exactly this issue, where we have, if you will, dueling recommendations. My approach to this is to look for a reputable source. That is, what are sources that I consider reputable, which are scientific sources within the United States, and use them as the gold standard for determining whether a recommendation should be followed or not. Many of us in medicine did not agree with this recommendation if you're talking about the World Health recommendation about contact. And I think we've been proven correct that you can still spread this virus through contact.
Thanks, Mr. Chair.
Thank you, sir.